Before anything else, I want to say something directly to you. You are not invisible here. And if you are over 60 and have been brushing off aches, stiffness, a slight stoop in the mirror, or a body that feels less reliable than it once did, I want you to know that none of those things deserve to be dismissed. Not by you and not by anyone else. Because here is something that most seniors are never told. Bones and joints can deteriorate for years without causing significant pain. The disease is progressing. The structure is changing. The risk is building, and none of it announces itself until something breaks. In the United States alone, an estimated 10 million adults over 50 have osteoporosis. Another 43 million have low bone mass. Most of them do not know. And the most alarming part is that the majority of people who break a bone from osteoporosis were never diagnosed before it happened. The fracture is often the first sign that anything was wrong at all. Today, we are counting down 7 warning signs that bones and joints may be silently deteriorating after 60. Signs the body is sending, signs most people misread or ignore completely. Each one is backed by research from the NIH, the Mayo Clinic, or peer-reviewed medical literature. And each one comes with a clear, specific action you can take. And when we reach number 1, you will discover the warning sign that is visible in the mirror every single day, that most seniors attribute entirely to age, and that research links to a 5-fold increase in the risk of another fracture if left unaddressed. Before we begin, let us know in the comments your age and where you are watching from. We read every single one. Now let us start with number 7. Number 7, unexpected tooth loss or receding gums. Number 7 is one that almost nobody connects to their bones, tooth loss. And specifically, teeth that loosen and fall out without obvious dental disease, or gums that recede in a way that seems to have no clear local cause. Here is the mechanism. The jaw is made of bone, and bone loss does not stay in the spine and the hips. It happens throughout the skeleton simultaneously. As bone density falls throughout the body, the alveolar bone, which is the bone inside the jaw that holds teeth in place, also loses density and volume. When the jawbone thins and recedes, teeth lose their anchorage. The process is quiet and gradual. And most people who lose teeth attribute it entirely to dental hygiene or genetics, rather than considering that systemic bone loss may be the underlying driver. Research published in a peer-reviewed journal found that patients with osteoporosis showed significantly more tooth loss and more severe bone resorption of the alveolar jawbone compared to patients with normal bone density. The connection is well established enough that some dentists are now trained to look for signs of low jawbone density on standard dental x-rays and to alert their patients to the possibility of systemic bone loss. Why do seniors dismiss this? Because tooth loss at this age feels like an expected consequence of a lifetime of dental wear. The idea that it might be signaling something happening throughout the entire skeleton rarely crosses anyone's mind. What you can do right now, at your next dental appointment, mention any teeth that have loosened, any recent tooth loss without an obvious dental cause, or any significant gum recession. Ask your dentist whether a panoramic x-ray could give information about your jawbone density. If they identify thinning, ask for a referral back to your doctor to discuss whether a DXA bone density scan is appropriate. A DXA scan is a quick, painless, low radiation scan that measures bone density in the spine and hip. It takes about 15 minutes. If you are a woman over 65 or a man over 70, it is a recommended part of routine preventive care. If you are younger than that with risk factors, the conversation is worth starting now. Number 6, frequent cracking or grinding in your joints. Number 6 is a sound most people have heard in their own body and largely ignored. The cracking of knees on the stairs, the grinding in the hip when getting up from a chair, the clicking in the shoulder, reaching for something overhead. Doctors call this crepitus. And while occasional joint popping is generally harmless, frequent grinding or cracking accompanied by pain, stiffness, or swelling is a different signal entirely. Here is what is happening. Healthy joint surfaces are coated with smooth, well-lubricated cartilage that allows bones to glide past each other silently. As cartilage thins and degrades, roughened surfaces begin to catch and grind against each other. The sound of that grinding is the sound of physical wear. In osteoarthritis, which is the most common joint condition in adults over 60, this cartilage breakdown is progressive. It does not reverse, but it can be significantly slowed with the right interventions, particularly when the changes are identified early. Research from a Veterans Affairs study followed adults who did not yet have symptomatic knee arthritis and tracked whether crepitus predicted future development of the disease. Those who reported grinding in the knee most of the time were found to be at a roughly threefold higher risk of developing symptomatic osteoarthritis compared to those with no knee noise. The sound itself may be an early marker of structural change, even before pain becomes constant. Why do seniors dismiss this? Because joint sounds feel like a quirk of an aging body rather than a message worth investigating. What you can do right now, pay attention not just to whether your joints make sounds, but to the context. Occasional painless popping is unlikely to be significant, but grinding that is frequent, that is paired with pain, swelling, warmth, or stiffness, or that is getting progressively worse, deserves a clinical assessment. See your doctor and describe the symptoms in detail. An X-ray can reveal cartilage loss and joint space narrowing. A physical therapist can assess movement quality and design a strengthening program that protects the joint. If you're finding this video helpful, please take a moment to like it, subscribe, and hit the notification bell so you never miss what we create for you. Number 5 is a warning sign about timing that most seniors get completely wrong. Number 5, morning stiffness that lasts more than 30 minutes. Number 5 is one where the detail most people overlook is not whether the stiffness is there. Almost everyone over 60 has some degree of morning stiffness. The detail that matters is how long it takes to go away. Here is how doctors use this information. The most common joint disease in older adults, morning stiffness, is caused by overnight inactivity, allowing fluid to pool and the joint to stiffen. When movement begins, that fluid redistributes, and the stiffness typically resolves within 30 minutes. In inflammatory arthritis, including rheumatoid arthritis, the cause is different. Inflammatory cells and fluid accumulate overnight in the joint lining. Clearing that accumulation requires sustained movement and takes significantly longer. The National Institute of Arthritis and Skin Diseases describes morning stiffness lasting less than 30 minutes as characteristic of osteoarthritis. Stiffness lasting an hour or more is a clinical signal of possible inflammatory joint disease. This distinction matters enormously because rheumatoid arthritis, if left untreated, causes permanent erosion of joint bone and cartilage. There's a therapeutic window, particularly in the first months to years of the disease, where starting the right medication can prevent irreversible structural damage. Missing that window because the stiffness was attributed to normal aging is one of the most common reasons people end up with lasting joint deformity. There is another clue that travels alongside prolonged morning stiffness in inflammatory joint disease: fatigue. A persistent, bone-deep exhaustion that does not improve with rest. Between 40 and 70% of people with rheumatoid arthritis describe fatigue as one of their most disabling symptoms, and it often appears before the joint symptoms themselves become obvious. What you can do right now. Begin timing your morning stiffness from when you wake up to when you feel genuinely mobile. Do this for 1 week and write down the average. If the stiffness is routinely lasting more than 30 to 45 minutes, tell your doctor specifically. Ask for inflammatory blood markers, including CRP and ESR. Ask also about rheumatoid factor and anti-CCP antibodies. And mention whether the stiffness is symmetric, affecting the same joints on both sides of the body, which is more characteristic of inflammatory disease than the asymmetric pattern of osteoarthritis. Number 4, deep bone pain or tenderness. When pressed, number 4 is a type of pain that most seniors either attribute to arthritis or simply accept as part of getting older. But there is an important distinction between joint pain, which comes from the space between bones, and bone pain itself. And bone pain, particularly when it is deep, dull, present at rest or at night, or when pressing directly on a bone surface causes tenderness, is a signal worth taking seriously. One of the most overlooked causes of bone pain in older adults is not cancer and not fracture. It is vitamin D deficiency. When vitamin D is severely depleted, the bones cannot mineralize properly. The soft, unmineralized bone tissue that results is called osteoid. It is structurally weaker and far more sensitive to pressure. The condition is called osteomalacia, and it is far more common in adults over 60 than most people realize. The symptoms develop gradually and are frequently attributed to arthritis, fibromyalgia, or general aging. The pain typically affects the lower back, pelvis, hips, and shins. Tenderness when pressing directly on the shin bone is a classic finding. What makes osteomalacia particularly important on this list is that it is one of the most fully reversible bone conditions in older adults. Vitamin D and calcium supplementation under medical guidance can dramatically improve bone tenderness and pain within weeks in people with deficiency-driven osteomalacia. That kind of reversal is rare in conditions like osteoarthritis or osteoporosis, which are far more difficult to reverse once established. What you can do right now, if you have deep, persistent pain in the back, hips, pelvis, or legs that is present at rest, that is worse at night, or that comes with tenderness when you press on the bone itself, mention this specifically to your doctor and describe it as bone pain rather than joint pain. Ask for a serum 25-hydroxyvitamin D blood test, a calcium level, and a phosphate level. These simple blood tests can confirm or rule out deficiency-driven bone disease. Safety note: if bone pain is accompanied by unexplained weight loss, night sweats, or significant fatigue, seek medical attention promptly, as these combinations warrant urgent evaluation for other causes. Number 3, declining grip strength and difficulty with physical tasks. Number 3 is one that many seniors notice, but interpret as a simple inconvenience rather than a meaningful health signal. The jar that has become difficult to open, the bag that feels heavier than it used to, the handshake that has lost its firmness, declining grip strength. And the reason it belongs on this list is that grip strength is not just about the hands. Research has established grip strength as a validated marker of whole body skeletal muscle mass and bone density simultaneously. A study using Mendelian randomization methodology, which tests causal relationships rather than just associations, found that hand grip strength is causally linked to lumbar spine bone mineral density. In other words, weaker grip and weaker bones tend to go together, because the same biological processes that maintain muscle also maintain bone. When muscle begins to lose mass and strength, bone typically follows. The connection to fracture risk is direct. Sarcopenia, the clinical term for age-related muscle loss, has been found in a large systematic review and meta-analysis to be associated with significantly higher risks of both falls and fractures in older adults. Weaker muscles mean slower reaction time, less ability to catch yourself when balance is disturbed, and less protection for the skeleton when a fall does occur. What you can do right now. Progressive resistance training is the most evidence-backed way to maintain and rebuild both muscle mass and bone density simultaneously. This does not require a gym membership or heavy weights. Resistance bands, body weight exercises, and even household objects can provide sufficient stimulus when used consistently. Aim for 2 to 3 sessions per week, targeting all major muscle groups. Also ensure adequate daily protein intake. Muscle synthesis requires protein, and many older adults consume significantly less than the amount needed to maintain muscle mass. Most nutrition guidelines for adults over 60 suggest at least 1 to 1.2 grams of protein per kilogram of body weight per day, spread across meals rather than concentrated in a single sitting. Talk to your doctor at your next appointment about having your grip strength measured and about whether a bone density scan is appropriate for your age and risk profile. Number 2, balance problems and frequent stumbling. Number 2 is the warning sign most likely to be laughed off in the moment and most likely to become a catastrophe if ignored. A stumble in the garden, a near miss on the stairs, a moment of unsteadiness getting out of the car. These events feel minor. They are almost never reported to a doctor, and they represent the body signaling that the muscle strength and balance systems that prevent falls are beginning to fail. Here is why this matters so much in the context of bone health specifically. Falls are the primary trigger for fractures in older adults. A fall onto an already weakened hip is how hip fractures happen. And hip fractures in older adults carry a 1-year mortality of roughly 20 to 30%. The National Institute on Aging lists gait problems, balance impairment, and sarcopenia as the primary modifiable contributors to fall risk in older adults. A meta-analysis found that sarcopenic older adults had a significantly higher risk of falls and a significantly higher risk of fractures than their peers without muscle loss. When weak bones and weak muscles coexist, even a minor stumble can become a life-altering event. I recall a woman named Margaret in her late 60s, who had been stumbling occasionally on uneven ground for over a year. She and her family had written it off as clumsiness and paid it little attention. When she finally fell on a garden step, a subsequent X-ray to check her wrist revealed not only a wrist fracture, but also evidence of reduced bone density that had been present and undetected for years. Her doctor said that if they had investigated the stumbling earlier, they could have started bone protective treatment well before the fracture occurred. What you can do right now: report every fall and every near fall to your doctor. Do not minimize these events. Ask specifically for a gait and balance assessment. Consider adding balance training to your weekly routine. Tai Chi has the strongest evidence base for reducing falls in older adults and can be practiced safely, even by beginners. Check your home for trip hazards, including loose rugs, uneven thresholds, and poor lighting on stairs. Have your vision checked, as poor vision is one of the leading modifiable contributors to falls in older adults. Now let us reach number 1, the warning sign visible in the mirror. The one most seniors have been told is simply part of getting older, and the one that research links to a 5-fold increase in the risk of another fracture. Number 1, losing height and developing a forward stoop. After 6 warning signs that most people would never connect to bone and joint health, number 1 is hiding in plain sight. A slight stoop in the mirror, clothes that hang differently than they used to, the realization that you are no longer quite as tall as you once were. These changes are so gradual and so universally attributed to simply getting older that the vast majority of people who experience them never mention them to a doctor at all. But here is what those visible changes may actually be telling you. In osteoporosis, the vertebrae of the spine can fracture under the ordinary loads of daily life. Not from a fall, not from an accident, from bending, from lifting, from the simple weight bearing of standing. When a vertebra collapses, the front of the bone wedges downward, compressing the height of the spine and tipping it forward into a curve. The medical term is a vertebral compression fracture. And the most alarming fact about them is that roughly 2/3 of them cause no significant pain at the time they occur. The only sign may be a centimeter of lost height, a slight forward rounding that was not there before. And because those changes feel like normal aging, they are almost never investigated. Research has established that measured height loss of more than 2 centimeters over a period of 1 to 3 years is a clinically meaningful predictor of a new vertebral fracture. And what a vertebral fracture means for future risk is serious. According to the NIH, a spine fracture is associated with a 5-fold increase in the risk of a subsequent spine fracture and a 2-fold increase in the risk of hip and other fractures. Each fracture in the chain makes the next one more likely, and it is the hip fracture at the end of that chain that carries mortality consequences comparable to a heart attack. Research published in the Journal of Orthopedic and Sports Physical Therapy found that older women with significant spinal curvature had a 70% higher risk of future fractures compared to those without it, even after accounting for bone density. The forward stoop itself, independent of what a bone scan shows, carries predictive weight. The treatment gap here is one of the most striking in all of medicine. Studies have found that approximately 75% of patients discharged after a hip fracture receive no treatment for the osteoporosis that caused it. The fracture that should have triggered a full investigation and a treatment plan instead gets treated in isolation while the underlying disease continues undisturbed. What you can do right now: have your height measured at every doctor's appointment and ask them to record it. Compare it to your tallest adult height. If you've lost more than 1 inch from your peak, or if you've noticed a forward rounding of the upper back that was not present before, ask your doctor specifically about these changes. Ask for a DXA bone density scan if you have not had one. Ask about a lateral spine X-ray or a vertebral fracture assessment, which can detect silent fractures that standard DXA scans do not always capture. And if a fracture or significant bone loss is confirmed, ask directly what bone protective medication is appropriate for you. This is a conversation that happens far too rarely and far too late. Here is what today's countdown tells us. Bones and joints do not fail all at once. They fail quietly, gradually, and with signals that the body sends long before anything breaks. Signals that are almost always misread as ordinary aging and left uninvestigated. 7 warning signs. 7 opportunities to intervene before the fracture, before the deformity, before the loss of independence that follows them. Unexpected tooth loss or receding gums may not be a dental problem. They may be the jawbone telling you what is happening throughout the rest of your skeleton. Frequent grinding or cracking in joints paired with pain and stiffness is not just the sound of getting older. It is cartilage speaking. Morning stiffness that lasts more than 30 minutes is not normal. It is a timing clue that could distinguish ordinary osteoarthritis from an inflammatory disease that requires urgent treatment. Deep bone pain or tenderness, especially at night, may not be arthritis. It may be a vitamin D deficiency that is completely reversible if caught and treated. Declining grip strength is not just inconvenient. It is a measurable signal of the same biological process that is weakening your bones at the same time. Stumbling and balance problems are not clumsiness. They are the fall that has not happened yet. And losing height and developing a forward stoop is not simply getting older. It may be a fracture that already occurred without you knowing, and a clear signal that the next one is coming unless something changes. The DXA bone density scan that could change the conversation is a 15-minute test. The blood test that could identify reversible bone pain is a single tube drawn at a routine appointment. The resistance training that could rebuild the muscle protecting your skeleton is available at home today, without equipment. Which of these 7 surprised you most? Leave it in the comments below. We read every single one. If you found this video helpful, please like, subscribe, and hit the notification bell so you never miss the next one. And share this with someone you love who is over 60. The warning signs in this video may be exactly what prompts the conversation that protects their bones before something breaks. Thank you for watching, and we will see you in the next video.